Right, now we'll get into vascular conditions where you have the vertebral artery going through the neck here. And what do we say that some of the symptoms are that you only see with vascular compared to others? Yeah, discoloration. But in this case, we're talking about the brain. What are the other ones specific to? Yeah, dizziness, nausea, things like that. Okay, now this is something that rotation of the neck, especially rotating it, extending like that, tends to be the movements that are going to compromise that artery. So a lot of times people will have it happen where, let's say they're at a hair salon or something, they have their head back in that booth like that. It's usually something that where there's some kind of problem already there, and then there's some precipitating movement or incident that brings it on. And what can happen is you can either constrict the vessel where you have a decrease of blood to the brain, or you can have a stroke where something breaks loose and goes up to the brain and has a brain clot. So the complaints are going to be, what this means with the C/C is chief complaint or complaining of, or complaining of. So the chief complaints are going to have vertigo, dizziness, pain, things like that. So vertebral artery impingement, again, dizziness, pain, vertigo. Usually it's going to happen with rotation and lateral flexion. Now, you can also have, dizziness can be a result of other things. You can have inner ear problems. Equilibrium can be off, so you can have dizziness. And we'll talk about, there's a special test for that, for a swivel chair test, where when I go like this, I'm affecting the vertebral arteries and what else? The inner ear, right? So if I do this, versus if I go like that, you have a chair that swivels and you swivel, the head stays the same. What am I doing to my inner ear right now when my head doesn't turn? I'm not doing anything, right? But I'm still doing the artery. But this, and it causes dizziness, it's more likely going to be a vertebral artery problem, versus if I do this, it could be either one. It could be the inner ear or the vertebral artery. All right, now we have repetitive injuries. So cervical degenerative joint disease, or DJD, or spondylosis, or osteoarthritis, all the same types of things. So basically what's happening is there's a differentiation between degenerative disc disease and degenerative joint disease, although a lot of times you have both together. Right? Degenerative disc disease is typically just the disc itself narrowing. So it's affecting the disc right here. Okay? If that happens, it's going to put more pressure on the bone, so you can have degenerative joint disease. Okay? And then also, if it affects the anterior motor unit, it's going to affect the vertebral bodies. And then what's the bony part in the posterior motor unit? What's the joint in the posterior motor unit of the neck? Facet joint. So you can have facet arthrosis. So basically what that is just extra bone being laid down, and you have osteophytes and things like that. That can cause problems. If it's towards the back of it, it can affect the nerve root, constricting the IVF. And what kind of symptoms are they going to have with DJD? Is it going to be worse any time of the day?
Worse in the morning?
Yeah, worse in the morning, cold weather, things like that. And then, like in this case here, there's some narrowing here and some osteophytes right there, but how does this appear? It's not so bad. So you can have, if it's related to a previous injury, let's say they had a whiplash injury years ago, and they have hypermobility at C5, C6, so then they may have osteoarthritis right there, but it doesn't appear. Versus if you see it throughout the whole spine, then that may not have been from a previous injury. That just means the whole spine's wearing out evenly. So if it's even wear and tear, it's just degeneration over time. If it's isolated at one particular area, it may be more likely that that was due to a previous trauma. So they're going to have general achiness of the neck, pain with certain motions. Whereas when we talk about facet, that's usually going to be pain on one spot of the neck with a certain particular motion. Whereas if they say it's just generally stiff all over the place, that's going to be more likely a DJD. So the pain is going to be generalized and it's going to be dull. Activity increases the pain or relieves the pain. Pain is worse in the morning and worse at night. It's going to be pain in a lot of different motions, not just one particular motion. Because if you're looking at generalized degeneration through the whole joint rather than if you have a cervical sprain or something or a facet problem, it's going to be affecting particular movements and motion in one certain position. You don't really see, in repetitive injuries, you don't really see like tendonitis in the neck. You know, you're going to see that more in the shoulder, the wrist, other areas like that. You don't really see it too much in the neck. What you do see as far as chronic situations in the neck is you have upper cross postural syndrome or postural strain. Basically what that is that the muscles on the front of the shoulder muscles get tight and these muscles get weak. The extensor muscles are tight and the flexors are weak. So you have this type of thing. Right? It can happen from things like being bent over like this, reading a book all the time. You guys don't do anything like that, right? So you tend to have tightness in these muscles here, tightness in the cervical extensors, especially probably up at the upper extensors. So the head's stuck like this, shoulders are sloped forward like that. So it's crossed. You have one side is weak, one side is tight and short. So then this side is weak, this kind of like that, and the shoulders are sloped forward like that. So with nerve conditions, you have chronic problems where we already talked before about IVF encroachment. Anything that's going to narrow that opening where the nerves come through, you can tend to have pain radiating down the arm. Nerve entrapment syndromes. So VA means vertebral artery syndrome. So you can have vertebral artery can be affected in the neck, or you can have thoracic outlet situations where arteries affected, or artery and vein are affected going down into the arm. All right, so then that's where we'll finish. So that what we've done is we've gone over the conditions of the neck and not thoracic outlet. Okay. So the conditions that we basically have gone over the anatomy part of the neck, a little bit of thoracic outlet anatomy, over conditions of the neck, but not thoracic outlet conditions. So that's where we'll go over next time. It's like 5 minutes to 12, right?
Yeah.
So just make sure that you know certain the conditions and what's unique about them. And somebody can have more than one condition, right? Because what's happening, let's say if you have a 70-year-old man that's driving and gets rear-ended, what kind of conditions could they have in their neck? Okay, what else? But if you just consider from that age group, and you could have what? You already have like a disc herniation versus facet problem or osteoarthritis. Okay, position of the head, yeah. What else?
Does it hurt all around or only in one?
Okay, all right. What about radiating pain would be a big thing you'd want to know about. Okay. If they had radiating pain, what kind of conditions would you suspect? Something affecting the nerve root. You know, that could have been just from the osteoarthritis, right? They could have osteoarthritis and that trauma flared it up. Or it could have herniated the disc. But at that age group, like I said before, when discs dehydrate over time, who's going to be more likely to have problems with a disc herniation? Some younger person that has a big fat plump disc versus someone else. It's like we talked about it where you have either a grape or a raisin. Okay? The grape's going to give you more problems than the raisin, right? All right.